Join HealthClick on an evidence-based educational journey into diabetes and the implications within rehabilitation programs. According to the CDC, more than 100 million Americans have either diabetes or prediabetes. This rise in diabetes has been at a steady rate and shows no signs of slowing down. Patients with comorbidities with diabetes will require more attention to specific therapeutic interventions to properly thrive. Gain an understanding of the physiological impact of diabetes and prediabetes on patients with neurological, orthopedic, or cardiovascular diagnoses. Explore the in-depth descriptions of the physiological effects that diabetes has on multiple bodily systems.
The lower the skin lipid content in type 1 and type 2 diabetes is much lower, and it's associated, again, with high fasting glucose and high A1C. So hyperglycemia, again, the culprit in an inefficient skin barrier. Normal adult skin is also slightly acidic. It's called the acid mantle, and it acts to repel some of the bacteria and the viruses and things that we come in contact with. That acidic barrier also facilitates this keratinocyte differentiation coming up to make a functional stratum corneum. And what we do know that the interogenous areas between anywhere that skin meets in type 2, folds in the skin, the axilla, genital area, anywhere that skin touches in a type 2 diabetic tends to be more alkaline. And this may be why there are higher levels of infection, especially of yeast infections that we see in different fungal infections.
Demonstrations with extensive explanations provide the tools for the clinician to perform comprehensive foot evaluations to include testing for range of motion, strength, skin integrity, foot deformities, gait dysfunction, temperature variances, protective sensation, proprioception, capillary filling time, and ABI. Learn the proper utilization of manual skills and testing tools which provide a solid foundation for objective assessments and progression toward measurable functional goals. Research trials are thoroughly discussed to address the relation of diabetes to exercise, neuropathy, education and outcomes, drug therapy, ulcers, amputations, visual disturbances, and gait.